colleagues, we're going to do a very brief overview of some of the concepts of how to treat and combining PTSD and substance use treatment. So complex treatment for complex problems. Next, please. Essentially, there are some traditional principles for treating comorbid substance use and PTSD. And these traditional principles are great principles, but in modern life we may need to begin looking at modifying them, which is the whole point of today's workshop. The first principle is to treat comorbid substance use disorder first, and then to treat the PTSD. The reason for this is that it's very difficult or impossible to do psychotherapy during acute intoxication or when a patient is withdrawing due to both physical and psychological complications. The next idea then is that the patient is transferred to follow-up treatment for PTSD after intensive substance use disorder, because in addition to the other considerations, patients also relapse into substance use if they attempt to do too much trauma too fast. Another precept is that the patient then follows up with aftercare or maintenance treatment for substance use disorder while continuing treatment for PTSD. And the final precept is that therapists have often been using only cognitive processing therapy or prolonged exposure therapy as a single therapy for PTSD, whereas what we're going to explore today is combining various modalities. Please. So, some of the challenges that we encounter in treating PTSD and substance use disorder simultaneously, and this is not just unique to substance use disorder, but it's even more of a challenge, and that is that virtual reality cannot reproduce all of the possible combat scenarios or traumas that an individual experiences in the course of combat. A more important precept, too, is that no one can predict which external stressors are going to occur during the course of treating combined substance use and PTSD, such that a person might end up relapsing due to some of these external stressors. So what we're going to now do in the lab with simulated patients from some of our faculty here at Hampton VA, we're going to formulate an innovative PTSD substance use treatment plan by combining traditional elements of the treatment plan, which includes 30 days of sobriety, not really much less because it takes that long to wash out some of the substances, but two specific innovations are what we're going to see today. First, we're going to be combining 90 minutes of either CPT or PE treatment for PTSD with a second session later on in the week with active integration of substance use treatment. And what I mean by active integration is that the individual is going to work with a therapist to identify how their PTSD stressors often trigger relapses into substance use disorder and how they can stop that process. The second innovation is that we're going to, instead of looking at using virtual reality alone, CPT alone, or PE alone, we're going to look at how to combine these things to address multiple forms of trauma.
Petty Officer McCall, it's nice to see you again. How are you doing today?
Okay, Doc.
All right. Today we're going to be doing something a little bit different. I know we've been doing some of the prolonged exposure, and you've really been having some difficulty remembering parts of the event and also kind of not being as activated by it, kind of staying pretty still. So we're going to add some things to it to see if that helps jog your memory, helps you kind of remember what happened that day. Okay? We're going to be having you experience what's called virtual reality. We're going to have a scene where it's a chopper scene. I'm going to, in a minute, put this equipment on you, and you're going to hear and see things like you might in a helicopter. Okay? Now, this helicopter scene is a Vietnam helicopter scene, so it may not be, because it's not, I know your experience took place in the desert, so the outside.
How can that be correlated to that? Vietnam?
Worth giving a try?
I'll give it a try.
All right. So I want you to give me your SUDS level 0 to 100 before we get started.
Right now, I'm about a 5.
Okay, so really not distressed at all.
No,
Pretty relaxed today.
Very relaxed.
Okay.
Just, haven't done this before, so
Okay.
a little nervous, but
okay.
no distress.
Okay. So I want you to put this as a visor. You put it on over your head.